Yes.
So we are live on location, Bridge Nation, at the Jamaica Pharmaceutical Society Annual Conference here at the Ocean Coral Spring Hotel in the beautiful Trelawney. I wish you guys could see our backdrop. It is absolutely beautiful. The sea is blue as ever. The sand white. Oh my goodness, it is amazing. I am now joined by the president of the Pharmaceutical Society of Jamaica, Dr. Winsome Beverly Christie. And before we chat, Dr. Christie, I just want to read something really quickly out of the conference guide that's here. And it says, as we slowly emerge out of this pandemic as a butterfly does from its cocoon, the executive of this noble organization has once again outdone itself by staging this year's conference as a hybrid event to facilitate our gradual entrance into our new normal of living with the COVID-19 pandemic. Dr. Christie, welcome to the Bridge. And how are you today?
Fine, thank you, and all the better for speaking with you, being here.
Tito nice. Dr. Christie, I just want to say, first of all, congratulations. This looks like this was a job well done, information well received, a huge undertaking. From what I understand, you took this position in the height of the pandemic. What was that like for you?
Well, it was challenging because everything was now Zoom. We were on lockdown, so everything was virtual. So because most of my training is done online, I was quite comfortable with it.
Okay.
But it was challenging in that you were posed with a lot of complex issues, and as a philosopher says, complex times calls for complex leadership skills. And so I had to be reaching out and designing different ways to lead the executive and lead the organization. We had to be flexible. This 93-year-old organization, which persons describe as a ship, had to become a plane.
Wow.
And, as we say in Jamaica, flex with the times.
Yeah.
And so we really were successful as an executive in that we were able to commandeer the profession and deal with the pandemic, not lose our goals and sights.
Right.
One of our mandates, our constitution states for us to educate our professionals, get them skills so that they can improve the health of the nation. In fact, World Health Organization has identified the 9-star pharmacist, which has various functions.
Yes, do tell.
They've recently added 2. It keeps evolving because they're realizing that pharmacists are so multi-talented and multi-skilled. So some of the functions would include an entrepreneur, researcher, educator, caregiver, all these.
Yeah, we don't really think about that because we just think we go to the pharmacy, we pick up the medication. We don't really think about what's happening behind that glass when you pick up the medication. So tell us a little bit about what a pharmacist does.
Well, a pharmacist's principle and what persons will think of is a dispenser, someone who provides medications or orders on the prescription of a licensed physician. And so we'll be dispensing medication, we'll be counting and pouring. But of course, the roles have changed, so we have pharmacy technicians who assist us now to carry out the roles. And then we realize we need to counsel the patients. We need to help them to understand that 1 tablet twice a day means morning and evening. Take with meals does not mean cornmeal, but with your meals to eat. This kind of communication thing.
Yes, which is important, very important as we're empowering the nation.
That's
this
right.
information, I think, is very critical.
Right.
Yeah.
Because the other day, a lady said to me, she said to me the other day, she took this pill because she was told to take it at bedtime, and she didn't realize she needed to sit up for a while to allow the pill to go down.
Oh, wow.
And to drink it with a glass of water. And as a result, she developed a little mild stomach irritation. So simple things like that are very important. And so when the pharmacist technicians assist us with the dispensing so that we can focus on counseling, these little points that people may think are not very important, we can then communicate to the patient, make sure they understand what we're saying, role play. So what did we say? How are you going to do this? Let them tell us what they're doing. So we're empowering them. Then we can explain to them more about their disease condition, educator,
Yeah.
right?
Yeah.
They can understand, then they can have a role in improving their health because it's their health. They're the ones swallowing their pill.
Yeah.
If they don't take it, then they're not going to get better. So it's not about going to the doctor and getting a prescription. It's about being actively involved in your health. If you need to lose weight, then you need to know how to do it. Stress-free, of course.
Yes.
If you have high blood cholesterol, you need to know what to eat and how to manage your portions
Right.
so that you can help to control your cholesterol. A doctor can't do that for you. A pharmacist can't do that for you.
Yeah,
you have to do
yes,
it for yourself.
Yes.
You have to get up and move. I can't move for you. So we have to empower them to know how to get their mindset. We had a one of the speakers this morning speak about the mind and how to get the person into that role of completing what they need to be doing, the
'Cause
goals.
it's a holistic thing. It's your mind,
Holistic.
your body, your soul.
Exactly.
All of it plays a part in getting healthy.
Exactly,
right?
in the whole healing process.
Yes, correct. Now, under your leadership, what is your aims and goals as the president of the PSJ?
That's the thing. My aims and goals is to help the pharmacists realize, because we have to educate the profession, that they can be the 9-star pharmacist. That goal is not unattainable.
Yeah.
And we have to know that there are different roles that we can play, and we just need to become empowered and empower the nation by becoming skilled ourselves.
Yeah.
This lifelong learning.
Yes.
Conferences like this.
Very
It's not
important.
about, I did my 4 years and they're that.
And that's it.
No, you have to keep changing with the time.
Yeah.
Knowledge increases,
Yeah.
and you have to get yourself educated
Yeah.
to be a good educator.
And if what the pandemic taught us was
Yes.
just that very thing. We had to learn how to pivot. We have to
That's
learn
right.
how to now go online to do things. You know,
That's right.
I think every business has been affected, whether negatively or positively. Every business has been affected. So I think it's so important that we are empowering and making sure that our pharmacists, which are, I guess you'd call them first responders, they're essential workers.
Yeah, they are essential
Workers.
Yes.
So empowering them and giving them the wherewithal and the resources that they need to ensure that they're doing their best job is very, very, very important. So kudos to you. What are some of the accomplishments that you have under your belt?
Well, as an organization, we were able to negotiate this pandemic. We were able to participate with the nation to help persons get immunized. In fact, pharmacists, we can boast, had the highest intake for taking the vaccines
Okay,
than
here
any
on the
other.
island.
We were
Okay.
70%.
Wow.
How we achieved that is we had each of the executive members being parish heads
Wow.
and
That's great.
communicating with the
That's great.
CEOs of the SMOs of each parish, getting the names of the pharmacists who want to do the vaccines and ensuring that they get to the sites. So we had a 70%
That's
uptake,
great.
which is
Congratulations with
even
that.
probably internationally that's
Yeah.
a high rate.
Wow.
And
Wow.
then we became trained as immunizers so that even though we were not allowed to administer the vaccines, but we could still educate persons about it. And so we could be advocates for that. We also became trained with the Bureau of Standards and JANAC to become certified antigen provider, antigen
Okay.
test providers,
Okay,
so that we could issue travel documents
Okay.
and help to ease the burden of the public sector because we could do testing.
Okay.
So we did
okay.
that. We also we did a lot of things. We became involved in a lot of committees. So the pharmacists now can be represented in every aspect of society. We're on the bioethics committee. We're on CARFA's research committee. We lobby with the Pharmacy Council of Jamaica to improve the scope of practice. And at this annual general meeting that we just had, we included the pharmacy technicians and pharmacy technology students as associate members, so they can join the association as
wonderful.
associate members.
That's
The
wonderful.
members agreed to that.
Yeah.
And we also confer some honorary life membership status to some persons.
Nice.
And life membership status. And we also reorganized the society so that we could improve it. We need to develop the property and improve it because that area is now 41 Lady Musgrave now is a real high class
Okay.
area.
Yeah.
So we, again, as a society, has to move to the changing
Yes.
environment. So we need to be working on developing the property. So that's another goal that I guess the next executive will be taking on.
I hear about a lot of growth and change and
Yes.
kind of moving forward. Let's
Yes.
talk about the youth. Bridge Nation, somebody out there right now, they're thinking about becoming a pharmacist. They don't know how to go about it. How does one become a pharmacist?
Well, first of all, you complete your up to the sixth form level of training. You need to have at least 2 A levels, 1 in chemistry. Bio would be good.
Okay.
And then, of course, you have the CXC subjects, okay, your chemistry, etc. And then you apply to UTEC or UE. UE has a doctoral pharmacy degree program. That's a 5-year program. So from start, you go straight into it, and you end up with a doctoral degree in pharmacy called a PharmD. Or you can go through UTEC, where you do a 4-year program and end up with a bachelor's of pharmacy. Then you can return after a year of internship to do their doctoral of pharmacy program. So you have 2 routes. So we have 2 universities at the moment that offer the pharmacy degree program.
Okay, guys, you hear that? So it's pretty easy to get in. Well, I don't know about the studying part, but it's definitely a viable
An attainable
profession. So please, all my students out there, if this is where you want to go, please, by all means. And Dr. Christie, I see that it's International World Pharmacist Day tomorrow. The
Yes.
theme that you guys have for this conference here in Jamaica is promoting health and excellence, empowering the nations. International World Pharmacist Day. Is this the theme that is going to be international as well?
No, the theme for the World Health Pharmacy Day is Pharmacy United in Action for a Healthier World.
Okay.
That's the
Okay.
theme. And so this theme emphasizes the pharmacist's positive impact on the communities in which they live. And we can say that we have, for Jamaica, done that.
Yeah.
As I mentioned, the United Nations, they have identified 17 sustainable goals that they want to implement to end poverty, protect the planet, and ensure that by 2030 all people enjoy peace and prosperity.
That was
Good,
important.
right? Good health and well-being is goal 3.
Okay.
This has 13 targets as it relates to non-communicable and communicable diseases. Non-communicable diseases means like illnesses that you can't catch. So like diabetes, cancer, cardiovascular, respiratory, all those mental health. Communicable disease would be like infectious diseases, HIV, tuberculosis, neglected tropical diseases, and of course COVID-19, right?
Yes, yes.
But we have seen for the Jamaican pharmacists, we are topping all of these. We are covering all of these. Go Jamaica,
yes,
right?
Absolutely. We must celebrate these wins.
Yes.
Go Jamaica.
Right. So we're doing excellent as a pharmacy profession.
That's awesome.
And so we now are continuing the goal of becoming a trusted health professional. The pharmacists are rated internationally as the most trusted profession.
Yeah. Well, you have to be going into a pharmacist. You have to. You're asking questions. You know, you want to make sure that your pharmacists are knowledgeable. You want to be able to trust.
That's right.
Trust is a really big thing when you go to a pharmacist
Right.
because these guys are, giving you your medications.
Right.
So trust is a big deal, I'm sure.
Right, and especially as it relates to confidentiality. We are trusted persons, know that we're not going to say, no, what she... You understand me?
Yeah.
You
Confidentiality.
keep persons,
Yes.
and then with the Data Protection Act, again, being flexible, we're going to align ourselves with that because we understand that there's obligation that pharmacies and pharmacy owners need to be doing to get in line with the Data Protection Act. So between the Jamaica Association of Private Pharmacy Owners, JAPO, and PSJ, we're going to inform the members more about what we need to be doing to ensure that we are in line with the Data Protection Act as it relates to our pharmacy practice.
Dr. Christie, thank you so much for first taking up the position of president of PSJ and for all that you have done and continue to do. We wish you well here on your journey as the president, Dr. Winsome Beverly Christie, the president of the Pharmaceutical Society of Jamaica. Thank you so very much.
Thank you. And I'd like to just remind you that we have an incoming president, so I'm actually outgoing.
Oh, you're outgoing. Well,
we just had an election.
Okay, awesome.
So we have a new...
So you're passing the baton.
I'm passing the baton.
Okay.
But I appreciate the interview. Thank you very much
for
for having me.
We're so happy to have had you.
Yeah, you
Awesome.
have a nice rest of the day.
You too. That's Dr. Christie, guys. And stick and stay. I believe we have a giveaway that's about to happen. I see a lot of gift baskets here. So, I'm doing a giveaway. Okay, so what's the giveaway question? Let's see, Bridge Nation. All right, so we again are live on location at the Ocean Coral Spring Hotel, Jamaica Pharmaceutical Society Annual Conference, and we are giving away for our Bridge Nation. By all means, we have a giveaway. We have a gift baskets, right? It's a Curel gift basket. Okay. We have a gift basket, lots of giveaways and surprises here. So the question is, how many types of Curel, how many types of Curels are there? That's easy. How many types of Curel products are there? I think that's pretty easy. Curel lotions. What's the number that they need to call to give away? I don't remember it out of my head. Bridge Nation, stick and stay. I'm going to give you that number. Again, we are at the Pharmaceutical Society Annual Conference here in the beautiful Ocean Coral Spring Hotel. And we are live on location. The laptop number is going to be 876-551-5578. No. Hold on. No, Danielle, come walk it over to me, sweetheart. Walk it over to me. This is not what we're doing. You're not going to read it to me. Bridge Nation, I don't have a photographic memory. All right, so the number is 551-5782, 551-5782. So the question is, how many lotions does Curel have in their line? Super easy. If you were listening earlier, you should know how many lotions does Curel have in their line. Call us now, 876-551-5782, 876-551-5782. Can I get the gift basket so our viewers can see? 551-5782. Give us a call in studio. So the gift basket here, I'm not lying, guys. See it here? So nice it is. How many lotions are the lines? How many lotions are in this line for Curel? 551-5782, 551-5782. Again, Bridge Nation, we are live on location at Ocean Coral Spring Hotel for the Pharmacist Society Annual Conference under the theme Promoting Health, Empowering the Nation. We'll be right back.